I'm Dr. David Roberts from Manchester West Veterinary Hospital. We're going to give you a tour of our hospital today. And it kind of starts as these doors are closed. That we have an automatic door on the outside, but we have a swing door on this side, so for pet safety, we don't want a pet running through the door and getting out into the street. What we did at Manchester West Veterinary Hospital is we created a hospital that has a separate canine area from the feline area. So our canine waiting area is a little bit larger, it's a little bit more open. You can see through the window here we have two groomers that are grooming dogs. They are full-time groomers, and we allow clients to watch these pets being groomed. It has a little bit of an entertainment value, but it also, if people want to watch their own pet getting groomed, that's great. We're going to walk a little bit this way, kind of show that we've got a bit of retail, little fun things for the pets. That's dental things for keeping dogs and cats' teeth clean. We carry various line of food. This is our reception area. The receptionists have a full computer and database. They have all the things they need to keep our clinic running. This is the other side of the area, and this is the feline waiting area. Feline waiting area is a little bit more confined. We try to keep the dogs out of here so they feel a little more safe and it's a little better experience for them. We're going to walk back down this way, and again we have more food and toys for the pets and various shampoos and products. And we're going to go into our treatment area. This is the behind the scenes part that not everybody gets to see. So when we come down here, down that way is just a staff area, washers, dryers, things. This is our intensive care unit in here. And the intensive care unit is something that we have recovering pets. We have pets that are on IV fluids, hospitalized pets, and those are the things that we want to make sure that we're being able to keep in track of. This is the doctor's station. So our doctors can sit in here, they can make phone calls, work on the computer, work on their charts, but they can keep an eye on their recovering patients, or they can keep an eye on the patients that are hospitalized and on IV fluids. As we move back further into the hospital, we're into our treatment area. The treatment area has all kinds of things that we are able to do in here. This is actually where we do our dental prophylaxis or teeth cleanings. This is the machinery that we use. It's just like in a human dental office. It has an ultrasonic scaler, and then it has a polisher. So we go through all the things with a teeth cleaning that you would have at your own dentist. Treatment area is where we usually will sedate pets or do minor little procedures. All of these areas have drops for oxygen. So we have them at the dental station, we have it here, and then we'll show you in the operating suite. This is what we call pack prep. This is sterilizing instruments right now. It's hot as we speak, and this will clean them. When we do our surgical preps, we'll scrub our hands, and we have a sink that has an electric eye, so we don't have to touch anything once our hands are clean. As we move into our surgery area, this is where we perform procedures. We have all the things that you would find in a human hospital. This is the same type of anesthesia machine that they use in human hospitals, a little smaller version. We have this little stuffed dog on a mask of oxygen right now. We have him hooked up to an electrocardiogram, and we have monitors that monitor the oxygen concentration within the patient. So surgery is all done sterilely. We've got all, just to show the sterile pack, which has instruments in it. It's a sterile gown, sterile gloves, drapes, different things that we need for the procedures, and but everything is done sterilely, just like in a human practice. As we kind of move through, we'll show you that we have X-ray capability. So in radiology here, we have a very high-tech machine that has the same technology in it that a mammogram would have, so it makes it safe for the patients. It's a low radiation type of machine, and so we can take X-rays and get them developed and have an answer within about 3 minutes. As we work down this way, we're going to show you our lab area. The lab has a machine that can check blood tests, which are the kidney function, liver function, screens for diabetes, looks at electrolytes. We have another machine that checks for the white blood cell counts, red blood cell counts, and all the other platelets and things of that nature. So that's more the cell counter. We actually have two microscopes in the lab. One we use for dirty procedures like intestinal parasite exams, and this is used for what we call cytology. So we can look at a bump under the microscope and tell an owner exactly what it is. When we turn around a little bit, we can see that on the same thing that in the waiting area holds true back here. We have separate wards for our dogs, and we have separate wards for the cats at the other end. So it's a little less stress for those patients. So as we walk through here, we'll show you also, this is our feline ward area, and it's a quieter area of the hospital. There's no kitties boarding with us today, but this is where they will stay when they come in for boarding, or if they're being hospitalized that they don't need to have intensive care. The other thing we did at our hospital is we have separate areas for our cats and dogs as far as our examination rooms go. And we'll walk into this examination room, and it's a little bit smaller. The tabletops are a little bit more friendly for cats, but all of our exam rooms have these things called otoscope, ophthalmoscope, to look in the eyes, look in the ears. Every room has a sink, which the kitties like to lay in, by the way. And so these rooms are never used for dogs, so there's no dog smells in here or anything like that. As we go to one of our canine exam rooms, it's pretty much the same. They're a little bit bigger. Laura's working on cleaning it up right now, but it has the same thing on the wall, the oto-ophthalmoscopes, sinks, and the exam tables, and even has radiograph viewers where we can show our clients their x-rays and exactly what we did and what it looks like. As we kind of move through, one thing at a veterinary hospital is that we have dogs or cats that are 5 pounds, and we have dogs and cats that are 150 pounds. Maybe not cats, but dogs. So we have to have our own pharmacy. So as we come through here, this shows us the pharmacy and our various drugs, and they have to be of all these different sizes, some even liquid, so we can use them for little, very small pets. But we have to take into account all of our antibiotics, the pain medications, medicines for vomiting, and medicines for diarrhea, and then specialty medications that are for parasites, like the worms that we'll see in kittens and puppies. And as we kind of move through, this ends the tour that when we have our pets come out of the exam rooms, like this fireman is doing right now with his new puppy, they'll check him out, and they will take care of all the instructions and let them know what they need to do when they go home as far as medications or anything like that.
Are Tuesdays good for you?
Tuesdays will work.
Okay. Dr. Roberts, first name.
Well, I'm Dr. David Roberts from Manchester West Veterinary Hospital, and that's your tour. It kind of gives you a little idea of behind the scenes and what we actually do here and what our capabilities are. Thank you.